Hi, thanks for joining me for a few minutes today. My name is Dr. Connie Stapleton. I'm a bariatric psychologist and a certified addiction therapist. I want to take just a few minutes today to talk about bariatric surgery, food addiction, and transfer addiction. There are just a few things that's important to understand here. We hear a lot about transfer addiction after bariatric surgery. There's a lot of misinformation about what transfer addiction actually is. And that's because there's a lot of misinformation about what addiction is. Addiction is a word that's thrown around very loosely, and it's not always used in an accurate clinical sense. Addiction is a chronic disease, just like obesity is a chronic disease. There's no cure for either disease. There is treatment and there is remission. Remission is when you have a reduction or disappearance of the signs and symptoms of a disease, but those symptoms can always reappear. Addiction, also like the disease of obesity, is a biopsychosocial disease, meaning there are a number of contributing factors leading up to the presence of the disease. Addiction is thought to be inheritable, just like obesity, and like obesity, can be associated with social, environmental, and emotional issues. Addiction can be summarized as a disease that leads to ongoing problems related to the use of a mood altering substance or engaging in a mood altering behavior to the point where there are ongoing problems. The problems can be physical, they can be emotional, they can be in relationships, and are related to the use of the substance or the behavior. So the person with the addiction wants to stop, but either because of the way the substance helps them feel better by numbing and soothing emotional pain, or because their body becomes physically dependent on the substance to feel normal, they're unable to stop. And the problems continue and often get worse. Now, if a person has both the disease of obesity and the disease of addiction, and they have bariatric surgery, the disease of obesity is treated, not cured, but the disease of addiction is alive and well. It's not been addressed at all. The brain is still going to be looking for the fix that it got from food, usually sugar or highly processed foods that it got before surgery. But because those substances are not easily ingested for some time after surgery, a person with the disease of addiction seeks another way to get that fix they need, a new way to ease the emotional discomfort they feel when they can't soothe themselves with food, or a different way to get that big old dopamine hit they're looking for from the sugar or the processed foods. So enter transfer addiction. The person with the disease of addiction seeks a different substance or behavior to provide that emotional comfort or the dopamine hit that the brain still craves. The disease of obesity has gotten treatment, the disease of addiction has not. So that pain relief or that emotional relief can come from alcohol, prescription pain medication, excessive shopping, gambling, exercise, sexual encounters, many other things. The addictive substance has been transferred from food to something else that the addictive person craves. Addiction and obesity are both serious diseases. They're treated in very different ways, and both need professional treatment. If you have an addiction, any addiction, talk to a mental health professional who is trained to treat addictions, just like you turned to professionals trained to treat obesity. Thanks for listening.